The gentleman from Texas, Mr. Olson, is recognized for 5 minutes.
Mr. Speaker, I ask unanimous consent to speak for 5 minutes and revise instead my remarks.
The gentleman may proceed.
Mr. Speaker, I'm convinced that sharing real stories from people in our communities is the best opportunity to put a human face on the task before us with respect to reforming health care. We have spoken about costs, tax increases and job losses, access to care, and government-run options. These are all important factors in this equation, and we have a duty to the American people to debate them fully. But there is also a human element that cuts through the debate and the rhetoric and perfectly crystallizes what's at stake here. My Republican colleagues and I have tried to impress on the other side the importance of maintaining the doctor-patient decision-making process. And I think that Joshua Loya's story says it all. Brittany Kraft is a constituent of mine from Pearland, Texas. She was 24 weeks pregnant in March of 2002 when her unborn son was diagnosed with hypoplastic left heart syndrome. She was told that he would not be born alive. Her cardiologist consulted with groups of surgeons around the country, but none could offer the help that she needed. Brittany was advised that her child could be put to sleep in utero and she could go directly to the hospital for a stillbirth. She was unwilling to accept this as her only option and decided to fight for her unborn baby. Brittany made copies of the fetal echocardiograms and sent them to the top 5 pediatric cardiothoracic surgeons she could find. Only one, Dr. Ed Bove at the University of Michigan's Mott Children's Hospital, said that if Brittany came to Michigan, they would do everything they could to save her unborn child. On June 26, 2002, Joshua Reuben Loya was born. He was immediately intubated and wired. He was in critical condition, and doctors felt that he was not a good candidate for the corrective surgeries available. He was listed for a heart transplant the day after he was born. And after 16 life-threatening days, at 3 in the morning, Brittany got the call that there was a heart for Joshua. Almost 7 years later, you would never know what Brittany and Joshua went through. He is a happy, growing boy with medical needs, but no limitations on a good day. He can run, play, sing, laugh, and dance. Unfortunately, he is immune suppressed and will be for the rest of his life. He takes 8 medications twice daily and must adhere to a very strict schedule to control the levels of medication in his system. Too little, and he is at risk of rejecting his heart. Too much, and the medications trigger kidney failure and disable his immune system, making him even more vulnerable to every germ around. I tell Joshua's story because, quite frankly, if the health care plans being promoted by the administration and my Democratic colleagues were to become law, I'm not confident that Joshua would be here today. I know that his mother is deeply concerned that with government-run health care, she might not have had the choice to deliver her baby and have access to the life-saving medical procedures needed to keep him healthy and alive. In a massive government-run bureaucracy, Americans may not have the freedom to make the individual decision that Brittany Kraft made to bring little Joshua into this world. She was in a position to not accept the word of a doctor and could search across the nation for a better chance at life for her unborn son. While some maintain that Americans like Brittany can stay on their private plans to keep government out of Joshua's health care, they are not considering the far-reaching implications of the government plan. A government-run plan means bureaucrats make the decisions and private insurers will be forced to follow suit to remain competitive. There is valid concern that otherwise healthy people will flock to the cheaper government plan and sick people will try to stay on private plans, putting private insurers out of business. Joshua's story puts all of this into crystal clear context for me, and I urge all of my colleagues to remember Joshua Loya as we go back home for the August recess and talk to our constituents about health care reform. Any reform must include freedom for individuals and their doctors to make their own personal health decisions. Mr. Speaker, I yield back the balance of my time.
The gentleman from New Jersey, Mr. Pasquale.